Hello guys, I am Dr. Ravindra Savarkar and I welcome you back to Med School. Topic for this video is right and left bundle branch blocks. Right bundle branch block is further divided into complete right bundle branch block and incomplete right bundle branch block. In complete RBBB, septum is activated first as usual, as most of the septal fibers arise from left bundle branch. Septal vector will be normal and right oriented leads shows small R wave and lateral lead shows Q wave. Next, left ventricle is depolarized normally through left bundle branch. For this vector, right oriented leads shows S wave and lateral lead shows R wave. Then impulse reach right ventricles through myocardial cells. This vector is directed toward right. That's why right oriented leads shows R prime wave and lateral lead shows S wave. As this activation does not occur through normal conduction system, conduction is slow and erratic. Because of this slow and erratic conduction, R prime wave in right oriented leads and S wave in left oriented leads are wide with slurring and can be notched. So ECG findings of complete right bundle branch block are RS-R' pattern in lead V1 and V2. This pattern is also known as rabbit ear appearance. Then QRS duration more than 120 milliseconds. And slurred S wave in lateral leads, especially lead V6 and 1. Here there is RS-R' pattern in lead V1. Lead V2 shows R wave which is slurred. S wave in lead V5, V6 and lead 1 are slurred. QRS duration is more than 120 milliseconds. Hence, there is complete right bundle branch block in this ECG. In incomplete RBBB, conduction is not blocked but only slow. Due to this, left ventricle and this part of right ventricle are depolarized at the same time. As V2 electrode is placed over this area, changes of incomplete RBBB are seen first in lead V2. Left ventricular activation vector is counterbalanced by vector of activation of this area. Hence, first change of incomplete RBBB is attenuation of amplitude of S wave. As severity of block increases, S wave becomes slurred. With further severity, RS-R' pattern is seen in both lead V1 and V2, and small R' wave may further increase in amplitude. At this point, QRS duration up to 120 milliseconds is the only differentiating feature from complete RBBB. I want you to remember that any one of the above changes can be found in incomplete RBBB. In this ECG, there is RS-R' pattern in lead V1. S wave in lead V2 is slurred and its amplitude is reduced as compared to lead V3. There is slurring of S wave in lateral leads. But QRS duration is normal. That's why it is incomplete RBBB. In RBBB, T wave is opposite in direction to terminal deflection of QRS complex. In lead V1 and V2, terminal deflection is R' wave, which is upright. Hence, T wave is inverted. In lead V5 and V6, terminal deflection is S wave, which is negative wave. Hence, T wave is upright. ST segment can be mildly displaced in the direction of T wave, that is depression in lead V1, V2 and elevation in lead V5, V6. RBBB can be physiological, means presence of RBBB does not necessarily represent underlying heart disease. When present along with heart diseases, prognosis depends on underlying condition. That means presence of RBBB usually does not affect the prognosis much. But there is one exception. When RBBB complicates anterior wall myocardial infarction, prognosis becomes worse. Left bundle branch block is also of two types, complete LBBB and incomplete LBBB. Interventricular septal fibers predominantly arise from left bundle branch. In complete LBBB, conduction through septal fiber is also blocked and septum is activated from the fibers from right bundle branch. This has two main effects. Firstly, septum will be activated from right to left instead of left to right with erratic conduction. Secondly, as septal activation is slightly delayed, it occurs simultaneously with activation of right ventricle. As ventricular septum is more muscular than right ventricle, combined vector of this two vector is also directed toward left. This will cause a negative deflection in right-oriented leads and positive deflection in left-oriented leads. Next, left ventricle is activated through cardiac musculature, which will make conduction slow and erratic, and its vector is also directed toward left. This will again cause a negative deflection in right-oriented leads and positive deflection in left-oriented leads. So, features of complete LBBB are R pattern in lateral leads, notched QS pattern in lead V1 and V2, and QRS duration more than 120 milliseconds. In this ECG, there is R pattern in lateral leads and notched QS pattern in right-oriented leads. QRS duration is more than 120 milliseconds. Hence, these changes represent complete LBBB. In incomplete LBBB, conduction through left bundle branch is not completely blocked, but only slowed. As you already know, septal fibers arise from left bundle branch. Hence, septal activation is delayed. Hence, septal and left ventricular activation occur at same time. As there is no separate septal vector, first sign of incomplete LBBB is disappearance of R wave in right-oriented leads and Q wave in lateral leads. As severity of LBBB increases, QRS complexes become slurred and ultimately notching may appear. QRS duration remains less than 120 milliseconds, which is differentiating factor between complete and incomplete LBBB. There is no Q wave in lead V5 and V6. Also, there is no R wave in lead V1 and V2. QRS complexes are slurred, but duration is less than 120 milliseconds. Hence, this is incomplete LBBB. In LBBB, T wave is opposite in direction to terminal deflection of QRS complex. In lead V1, V2, T wave is upright, and lead V5, V6, T wave is inverted. ST segment may deviate in direction of T wave, that is depression in lead V5, V6 and elevation in lead V1, V2. LBBB indicate underlying cardiac disease. Recent onset LBBB can be a sign of acute myocardial infarction. And patient with heart failure with LBBB benefits from biventricular pacing, that is cardiac resynchronization therapy. Thank you for watching this video till the end. If you have any query or suggestion, please write it down in comment section. If you like my work, please like this video and share it with your friends. To get notified about next video upload, please subscribe to the channel and hit the bell icon. Till next video, take care and keep learning.